on our website. Just go to KUTV.com. Heart disease is the #1 killer of both men and women in the United States.
Well, that's why it's so important to manage your heart health. And one of the best ways to do that is to control your blood pressure.
One of the major risk factors associated with increasing the risk of a heart attack or stroke or other cardiovascular events is high blood pressure.
For a healthy heart, controlling blood pressure is essential. This can be done through a healthy lifestyle combined with medicine.
Some patients just have to take blood pressure medicines to get their blood pressure down, and thank heavens we have medicines available now.
But by using medication to lower blood pressure, there can be side effects.
If you have to take medicines, is it better to target just below 140, or should you go more aggressive and go down to below 120?
A national study was put together called SPRINT. It took patients with high blood pressure and randomized them into 2 groups. Group 1, targeting a blood pressure below 140. Group 2, below 120.
A lot of it was in the 150 range, and they wanted me to be more in 140.
Mike Cardiologist participated in this study. He's had high blood pressure for most of his life, but a few years ago while skiing, it caught up with him.
And I ran out of breath, and it wasn't like me because I've been there dozens of times, and all of a sudden I can't breathe very well.
He saw a doctor and found out his arteries were clogged.
I was out of breath, my heart wasn't pumping enough blood, so they put the stents in.
When the SPRINT study came calling, Mike didn't hesitate to participate.
They take your blood pressure, interview you, give you some medicine to bring it up or down wherever.
The plan was to study these patients for 5 to 7 years, looking to see if it made a difference in whether they had a heart attack or whether they had a stroke or whether they died.
However, the study was stopped early because the answer was so clear.
Turns out the patients that were randomized to have a target of 120 or less did better than the ones that didn't.
Now, for more ways to improve your heart health and reduce your risk of heart disease, be sure to tune in to KUTV all day today. We have help. Experts from Intermountain Healthcare will be in studio to answer your questions about heart health. For more information about today's Ask the Expert, you can go to our website, KUTV.com. Yeah, they'll be start manning